Welcome to the Alphagenix Podcast, where every week we speak to incredible people from the world of health, well-being, longevity, and of course, men's health. So I'm absolutely delighted today to introduce Gil Tal, all the way from the US, Director of Elevate Wellness Group. Welcome, Gil.
Thank you so much, Ross. I appreciate you having me on.
Really looking forward to it. You're one of the people who, I guess, inspired us to start Alphagenix, watching all of your stuff that you put out there over in the US, and it was so different to how it's done in the UK. It kind of made me want to sit up, take note, and do something about it. So thank you very much for that.
Oh, it's a pleasure. It's actually news to me and pleasantly surprised, but I'm happy to hear it because all too often the standard of care, both abroad and here in the US, is so flawed and so old school, and people refuse to look at the latest literature and update their protocols. So to see somebody start fresh out of the gate with correct and modern science is extremely refreshing.
Love it. Well, let's dive into it. So who is Gil Tal? How did you start in this industry, and what does the future hold?
Well, to keep it short, I've been involved in health, wellness, and fitness, nutrition, training, biochemistry, etc. Ever since I took an interest at the age of 14, going back now to 1991. I'm 46 years old this year, and I've spent most of my life as like a math and science nerd, if you will, in various different industries, but it's always been my passion. So I've always been an independent researcher. I've always looked into the science of how to optimize your health, your body, your mind. And like I said, since the age of 14, I got my very first weight bench, a couple of those sand weights that they used to have back in the days that you had to fill and weigh in order to add or remove weight back in the old times of weightlifting when going to the gym wasn't cool yet. And started lifting in my bedroom, as a teenager. And since then, I've just always been fascinated. I got my first bodybuilding magazine with a picture of Arnold on the cover, and I said, "This is amazing." I watched Rambo and the Terminator, and I said, "These guys are like walking machines. How does a human even become like that?" So I started becoming very fascinated and almost obsessed with figuring out what the heck's going on. So I enjoy this. I mean, to me, I don't even own a television. To me, studying, reading, researching is really just my passion. People say, "What do you do for fun? What do you do to relax?" I have many hobbies that are adrenaline based, but what I truly enjoy when I put my head down at night and I want to relax is instead of turning on the television, I grab my laptop and I read studies. And that's just what's always spoken to me. So I am a registered nurse, a few months away from completing my nurse practitioner, followed by my doctorate. What I do is I direct a group of men's wellness clinics, which I am a co-owner of in several states. We do nationwide telemedicine, so we cater to men all around the United States. For patients or clients who are outside of the United States, I do have a consulting-only service. Sadly, we cannot prescribe medication outside of the U.S., but we do sort of like a second set of eyes, if you will, for those that don't have access in their countries. Your patients are fortunate to have you there, but oftentimes in other parts of Europe, Canada, Mexico, Asia, etc., Australia, they don't have access to the best of care, not because their providers aren't well-intentioned. It's because the level of I guess, information or access to medication or treatment in some countries is not up to par. So oftentimes I'll get guys that are looking for just informational consults, maybe a 30-minute Zoom or phone call, to just go over their labs, go over their symptoms, see how they're feeling, and kind of give them a plan of action that they could take back to their practitioners within their countries or exercise on their own to try to optimize their life and get better.
Yeah, I love that, because I think most countries are a little stuck, aren't they? And even their physicians may have their hands tied because of the protocols that are driven by, for instance, in the UK, the NHS,
Right.
where even if the doctor wanted to, they couldn't prescribe what we do because they're not allowed. So,
and it's no different in the US. When you're a participating provider and you're credentialed with insurance companies, you kind of have to practice according to their guidelines. So certain objective values, for example, on labs, are going to determine whether someone is qualified or disqualified from a particular treatment. The reason we do not accept insurance in our offices is because we'd rather work for the patient. So when I take a check from an insurance company, that insurance company becomes the boss. They dictate how, when, and why things are done. And their main goal is to save money, not to make the patient feel better. They are a business after all. When you as a patient walk in and there's just us and you're the one writing the check, you're the boss. So now we answer and cater to your needs, obviously with ethics and medical necessity, but nonetheless your needs. And your goal is to just feel better and optimize your lifestyle. Sure, you want to save money where prudent, but you also don't want to save money at the expense of your health. So if you come back and your lab values are a couple of points above what they quote unquote call the qualifying range, you can still obtain treatment, whereas an insurance company would have denied you. And that's just one example. There's many examples of why insurance-based practice is extremely flawed and biased and geared towards big pharma and keeping people treated and medicated for life rather than actually tackling the underlying issue that is causing most of their symptoms.
Yeah, but taking control of their own health. And I remember watching a video of yours a long time ago, which resonated as well because of how we do things, which was about empowering the patient. It's about education.
Right.
Yes, you could get somebody in 5 minutes, check their labs, give them some meds, send them on their way. But actually, what happens when they leave the clinic? What happens when they leave our care?
Yeah,
actually, that's the difference, isn't it?
It's funny you say that because the philosophy behind what I do comes a lot from the nursing background. So when I was looking for, and mind you, I've been doing this a lot longer than I've actually had the formal title. I went back to school later in life. I've had my original degrees were in business and finance and economics. I've gone back to school for the medical route because I truly enjoy studying this type of science. And when I debated on, medical school versus PA school versus nursing school, a couple of factors came to mind. One of them is that the medical route, both PA and medical school are considered the medical route. They teach you how to look at a problem, address the problem, solve the problem, move on. The nursing route takes a holistic approach. It's a whole person approach. It wants to understand why this happened in the first place. What do we do acutely to treat the problem now and resolve the issues or subside any pain? And then how do we prevent the recurrence in the future? And a lot of what they teach is based on patient education or patient autonomy. So it's empowering a patient to actually take matters into their own hands and resolve issues for themselves, give them a level of understanding, hold their hand, guide them, and really make sure that they are their own best advocate, rather than just saying, if you have A, you take medicine B and you go home. If you have A, it was caused because B, C, and D, and it's going to come back if you do X, Y, and Z. So let's fully understand why this is going on so that we can prevent this and give you the best fighting chance and an optimal life. And that's really what attracted me into the path that I chose. It's really much more of a nurturing / patient education process. Allows you to spend more time rather than just fix and move on.
Yeah, I'd never thought about it that way, but I'm a what you'd call me a physical therapist, a physio over here in the UK. Very much the same thing. It's holistic, it's patient-centered, it's education-focused. It's looking to find out what the cause is, the root cause, and change that rather than sort of gloss over it with a Band-Aid.
Right. And again, it's I think it's not to make comparison. Every professional within their right is very noble and caring and nurturing and empathetic. It's just a little bit different. And for me, I'm not into the volume model. I'm into less quantity, but increasing the quality of care. So we can spend 30 to 40 minutes with a patient and make sure that they truly are educated, make sure that they can teach back what they've learned to show proficiency, which is key. Sometimes you're speaking and you kind of lose people, but they don't want to interrupt you or they're embarrassed to say. So we'll stop every so often. We'll say, can you go ahead and just explain to me what we've just gone over? And if you don't understand, that's okay. I'll do it again for you in a different way. But can you please teach me what I've just taught you? And now they can demonstrate proficiency. So you can kind of set them free, knowing confidently that you've made a change.
Amazing. Yeah, I love that. So what's the sort of typical gentleman that approaches you in your clinics?
That's a great question. You would think that, we can close our eyes and kind of imagine the ideal guy who would come in with low T or low testosterone symptoms, right? It's probably somebody who's middle aged, maybe, late 40s, early 50s, complaining of sexual dysfunctions, slightly overweight or possibly obese, tired, fatigued. You would think that would be your typical picture perfect male patient. Sadly, in the last, I would say, 3 to 4 years, we've seen a trend downwards of much younger men coming in. Now, I will put away the outliers of the quote unquote, what I call medically curious. These are the guys that just want to come in because their buddy told them he put on some muscle in the gym and he's on testosterone, and they're just kind of like, saying, hey, I got this symptom, I'm fatigued, I have erectile dysfunction. They just kind of want to get a prescription, right? So let's put those outliers away. We're getting a lot of guys in their late 20s, early 30s that are coming in, and we are clinically diagnosing them with what's called secondary hypogonadism or pituitary hypofunction, whereby their pituitary gland is now failing to send the gonadotropic signal, specifically luteinizing hormone, to their testes, requesting that they produce testosterone. Now, oftentimes this could be secondary to lifestyle, drug abuse, some prescription medications, alcohol, lack of sleep, stress, anxiety, depression, shift work. So there's a lot of things that they can do on their own to potentially fix the problem, because I hate to relegate a younger man to a lifelong treatment that could otherwise be fixed by what is actually causing the problem. I don't want to mask a problem with a Band-Aid just to get a solution that could have been done in a more efficient manner. But we've had guys with TBIs or traumatic brain injuries, right? A history of genetic predisposition to low testosterone. We've had guys that come in and they're 27, 28 years old, and they look like they've never gone through puberty. So it could be a combination of environmental factors. It could be a combination of poor nutrition. But overall, we are seeing a trend downwards of guys that are now younger and younger coming in and requesting treatment based on being symptomatic at an age where otherwise you would not expect to see.
Yeah. And do you think, what are the main drivers there? We've got the quality of our food, perhaps. There's too much sugar in our diets. We're more sedentary than we used to be. Quality of our water.
I've hypothesized about this often because this question often comes up, especially from young guys who are quite shocked to see their lab values. Even when they're symptomatic, they still write it off as, oh, maybe I'm just tired. And then their labs come back and they're like, I don't understand what's going on. So they always say, why did this happen? I think it's a combination of all of the above. Unless you can pinpoint one specific individual who perhaps is self-destructive in his ways, I think it's a combination of all of the above. You have to remember, social anxiety is at an all-time high. We have more access to social media than ever before. You can be sitting in the UK and here you are following the lives of people across the pond that you never would have had the access to meet, let alone be intimately involved with on a day-to-day basis in regards to their living habits. Now, nobody really goes out there and posts their hardships. People like to paint this picture-perfect image of how great their life is, of how much money they make, of how big their house is, of how beautiful their girlfriend is, right? So when you go in there and you're seeing all of this, and then you're looking in the mirror and you're looking left and right, and you're saying, my life sucks. Everybody out there in my age is so far ahead of me, and they've got the life that I dream of. And yet here I am over here grinding, teeth and trying to pull strings, and it's not happening for me. This is a fallacy. This is smoke and mirrors. This is a show.
Yeah.
Social media is causing a lot of anxiety, especially for teenagers. It's causing a lot of depression, and it's causing a lot of people to turn to stimulants or dopamine agonists to try to feel a false sense of happiness. It's causing people to turn to depressants like alcohol and marijuana and things to just kind of try to numb the pain. And all of these are having a secondary effect on their hormone milieu or hormonal balance, if you will. So I think that social media is really doing a number on the younger generations. I mean, for us, we're probably both, I'm just going to take a guess here, we're probably around the same age.
Exactly the same.
Okay. Yeah, for us, we've grown up in a different world. We used to come home drop our books, run outside, play ball, ride our bikes, kick a ball around, shoot hoops, whatever it was. We were out, we were active. Our friends were face to face. Nowadays, you see people sitting at a restaurant and everybody's texting, and there's no social interaction. The only social interaction you have is with a digital platform of people that don't really exist in your world, and yet their life seems to be perfect. And I think that is a tremendous non-environmental factor, but more of a mental psychological factor of why people are more depressed than ever, prescribed antidepressants left and right to treat these symptoms rather than addressing the issue of hormonal imbalances. They're just being numbed and tranquilized, and it's very hard to come off of those treatments eventually.
Absolutely. I think I guess layered into that is the fact that men are more predisposed to those destructive behaviors than
they are, because we have so much social pressure. So women have a social pressure of looking a certain way, which again, why you look at the cosmetic/plastic surgery industries again at record highs. But men have this image now of you have to be successful, you have to earn money, you have to buy fancy cars and real estate and watches and nice clothes. You have to look the part. You have to have a six-pack. You have to be tall. You have to have, certain color hair and eyes, and you have to fit this image of what women claim to want. So you go on Instagram and you see a picture of this guy and he's got 5,000 likes from women, and you say, maybe if I look like that, women would like me, but I don't know how to look like that. So they become obsessed with an image that is unattainable, and they fall into a deep depression.
Mm-hmm. Yeah.
This wasn't the case years ago. We didn't have access to these things. People would just go out and eat and say, you know what, you have a cool personality, you look okay, and let's hang out. But nowadays it's people think they need to be something that really doesn't exist too often.
Yeah, absolutely. And I guess then that drives behavior like drinking too much, binge eating, poor nutrition.
Self-destruction comes out of despair. When you've hit rock bottom, right, you don't see a way out. So rather than, you're so deep in the hole that it's so hard to climb out, it's easier to just sit at the bottom of the hole, feel sorry for yourself, and crack open a bottle. It's just so much easier at that point. And then you hope that somebody notices and offers you a helping hand or pats you on the back and says, don't worry, it'll be okay. It's really a cry for attention coupled with a numbing opportunity to just kind of put it all away for you.
Yeah, absolutely. And you just get stuck in this negative spiral, don't you? But I guess that's where TRT can make a huge impact, because it's that shock to the system that makes you spiral back positively again.
Yeah, so it's multifactorial. And here's what I love about guys that start TRT with the right mindset. And this is where the consultation from us is extremely important. I say us, I mean guys like myself and yourself and the staff that works for us. This is where we come in a very important manner. This is not just a medical consultation. Oftentimes it is extremely psychological. Sometimes people need a helping hand in terms of just a little bit of encouragement. They need somebody to say, hey, I've been there, I've done it with hundreds or thousands of guys. You're going to be okay. You're going to get better. Because that sense of motivation really is what's going to push them over the edge to start making changes to the way that they view themselves, and more importantly, the way that they live their life. The medication in and of itself is going to have a positive impact on some of the things that brought them down in the first place. But it is not a magic pill. I always tell guys, testosterone does not work for you. It allows you to go out and work for yourself. It's going to give you the drive, the motivation, and the energy potentially if you do everything else correctly. You have to get out and lift. You have to get out and fix your diet. You have to get out and fix your sleep. You have to get up and have a positive outlook and fix your mindset. Without all of those things, you're just going to be another fat, lazy guy laying on the couch on testosterone. And there's many of those out there as well. But by giving them the tools, both from a medical standpoint as well as from a psychological standpoint, I see the enthusiasm and I see the light in their eyes when they walk out of that office of how much they're willing and wanting to change. They just needed that little push, that little kick in the butt. Remember, it's like a freight train. Very hard to get it moving, but once it's rolling, you can't stop it. There's a lot of momentum there. You give them that little kick of momentum and they run with it. They're coming back in 8 weeks completely changed.
Love that. That's a good point, actually. How often do you review your clients?
So when we start guys initially, and it really depends on their initial labs coupled with, have they been on treatment before? If so, what kind of treatment, what other comorbidities or medications? I would say for the most part, just to keep it, as a blanket statement, I like to see guys 8 weeks after we get our hands on them. So I'm going to give you a protocol, whatever that may be, and I would like to see you back in 8 weeks. Number one, I want to have a conversation with you. Number two, I want to get on a second set of labs. So we have your baseline, we have your 8-week labs. The medication we use primarily for testosterone is testosterone cypionate with a 7-day half-life. It takes 5 half-lives in pharmacology to hit what's called a steady state. So 5 times 7 is 35. So presumably, if you change nothing in terms of dose and frequency, 35 days from your starting point, you will be at a steady state. Steady state means that your levels are not increasing and they're not decreasing so long as no other variables have changed. In a perfect world, that would hold true. In the real world, your body changes. So the way your body metabolizes and uses medication changes, especially as you're making changes for the better, exercise, diet, etc. But this is as close as we can get to a steady state. So 35 days to achieve, and then another 3 or 4 weeks of living at that point to allow the subjective data to come back a little clearer. Because I could draw your blood on day 35 and I have a steady state, but that hasn't given you sufficient time to report back how you're feeling living in that environment because you've just started. So I like to go 8 weeks. It's long enough to give me what I need objectively and subjectively. It is short enough to allow me to catch things and make tweaks and updates to you without dragging you out too long and making you suffer for no reason.
Yeah, that makes a lot of sense. Yeah, I like that.
I will say on follow-ups, though, we will generally extend. If you do report feeling better and everything looks great, we can go anywhere from 3 to 6 months between labs. Guys that are dialed in, been with us for a while, know what they're doing. I'll do labs twice a year on those guys, just as a checks and balances, make sure everything is well, give them an opportunity to have a scheduled consult. They're always welcome to have an unscheduled consult if they see the need, but we'd like to touch guys at least twice a year. When I say touch, it could be over the phone as well, but get a set of labs, get a conversation going at least every 6 months, but some guys do require a little bit more frequent than that.
Mm-hmm. Yeah, definitely. And do you find any particular symptoms improve first? Is it always their energy or is it always the libido? What do you generally see?
Good question, and one that you can imagine comes up often from patients. I find that the psychological symptoms generally tend to improve far sooner than the physiological symptoms. So what does that mean? Your bone mineral density is a physiological aspect that will improve anywhere from 12 to 36 months after you begin therapy. When you're looking at things like endothelial health, cardiovascular health, neurological health, these are things that are going to also improve 6, 12, 24 months out from when you begin. Muscle increase, fat decrease, right? These are things that are going to take 3, 6, 12 months to actually materialize. What we notice in the first 3 to 4 weeks after people begin treatment is that they have reports of better mental cognition, less forgetfulness, more motivation, a little more of a second gear throughout the day. They're not passing out at 4 p.m. They actually want to get up and go to the gym. And as you mentioned, libido is a big one. 3 to 4 weeks in, guys will report an increase in their sex drive or their desire, or the amount of times a day that they do think about sexual activities increases. And that all comes back from that natural male aggression, right? Testosterone is not just anabolic, it's also androgenic. So it gives that natural hunter instinct back, where guys tend to lose it as they age.
Yeah, absolutely. And that can be really powerful, can't it? To have that feeling of masculinity back again is one of the things that really drives people, I think, to then want to be better.
It's extremely empowering for guys, especially if they've lost it and they used to be alpha and now they feel like they're no longer their old self. It really is empowering. It is confidence inspiring. And this is where their demeanor really starts to change and they start to take control of things around them again.
Yeah. And I think if you then, some of our guys will also be on like a low dose tadalafil, and I take it. And that as well was like a game changer, because straight away you get morning erections back. And again, that kind of bleeds over into how you feel about yourself.
Yeah, low dose tadalafil, I have a whole 30-minute video discussing that and all the benefits. Some guys do benefit from it. I mean, a lot of them do. I wouldn't say it's a one-size-fits-all, but we do have a lot of guys that do benefit, especially if you're a guy that goes to the gym. You're going to get that nitric oxide boost, increased pumps, vascularity, energy. definitely another approach that I recommend to many of our patients.
Yeah, I was smiling when you said that, because I go to the gym with my wife quite often, and I'll be going, look at my arm, look at my arm. It's all pumped up and more vascularization.
Try coupling that with 3 grams of L-citrulline and creatine. And a little bit of sodium in whatever it is that you're drinking as well.
Right, okay, yeah, because I take creatine in the morning, and L-arginine, but L-sertraline is the precursor to L-arginine.
So L-citrulline and L-arginine are both nitric oxide booster, and it occurs via a conversion. I like to do it about an hour before training, because it is an amino acid. It's fairly in and out fairly quickly. And then when you add in the sodium, what happens is now you're causing a vasodilative effect with the tadalafil coupled with the aminos. You're allowing the blood vessels to dilate. When you dilate blood vessels, you also lower blood pressure. But when you're training, you're increasing blood pressure. But what you want to do is you want to increase the amount of plasma or fluid in the blood vessels, and that increases the pump. And the way you do that is by adding a little bit of sodium, because sodium gets reabsorbed in the kidneys via aldosterone. It travels into the bloodstream, and it creates what's called a hyperosmolar environment. So you have higher levels of sodium within the blood, and then you're drinking water, and that water gets sucked into the vascular space. So oftentimes where people have edema or subcutaneous edema where the water spills out, it's an electrolyte imbalance. So by having your sodium intake with your water while you are exercising, you are ensuring that that water remains in the bloodstream, because the water comes in to dilute the sodium so that your sodium level doesn't increase too much. So you're going to have a nice pump. You're going to have vasodilation, hypervolemia, which is increased water retention within the blood vessels. And the pumps in the gym are, remember that old video from the 80s where Arnold said the pump is better than sex? You know, this is what he was talking about. It was that blood pump that gets into the muscle. So the more you can do to increase that pump, really, I mean, if you're training in bodybuilding, that's the goal. If you're training for, like, let's say a CrossFit or a marathon or something that's endurance or performance based, you don't want the pump, because the pump is going to cripple you. But if you're lifting weights, that pump is really what it's about.
Yeah. So a little bit of sodium in there as well.
Oh yeah. I salt up my intra workout drink, you know. So I may even take like a Gatorade. This way I get some potassium, some sodium, some glucose, and I'll add a spoon of actual like pink Himalayan sea salt into that Gatorade. Now it's the very best, but it's gonna I mean, your veins are gonna pop and you're gonna feel those pumps.
Love it. I'm definitely gonna do that tomorrow.
Experiment, right? See what works.
Yeah, find out what works for us all. We're all different.
Yeah.
So what is your take on estrogen? Because for many years, estrogen has been vilified. If you're a guy, your estrogen went up. It was like, you got to get it down. You got to get it down. And I think a lot of that came from the bodybuilding environment that we've just been talking about. What are your thoughts on that?
Okay, so struck a nerve here. Okay, estrogen is extremely beneficial to both men and women. It is not a female hormone. It is a hormone that females are dominant in. Just like testosterone is not a male hormone, it is a hormone that men are dominant in. Both men and women need testosterone and estrogen. Now, when we say the word estrogen in the realm of TRT, we're talking specifically about estradiol. You have estrone, estriol, and estradiol. Estradiol is E2. And E2 is the most potent form of estrogen. The other two are metabolites. So estradiol in women is produced primarily in the ovaries. A little of it is occurring the same way as it is in males, and I'll get into that in a minute. But primarily a vast majority of estrogen in women is produced by the ovaries. The ovaries are a gland that secrete hormones into the bloodstream, specifically estradiol, progesterone. But when estradiol is secreted from the ovaries into the bloodstream, by definition, a gland that secretes a hormone into the bloodstream for systemic circulation is what we call an endocrine gland, and that hormone is called an endocrine hormone. That means that it circulates throughout your body to take action on receptor sites throughout various tissues in the body. Now, in men, as well as in postmenopausal women, estrogen is not an endocrine hormone. And it is a key to understand what this means and why this is so important. Because no matter how much I explain estrogen, men will still come out and say, but what if my levels are here? Or what if they're here? What if they're here? This tells me they don't understand what an endocrine hormone is and is not. So when estrogen is not an endocrine hormone, what do we mean by that? Remember, outside of the liver, which produces less than 20% of the total estrogen, which isn't really that relevant, men do not have a gland that produces estrogen directly and excretes into the bloodstream for systemic circulation. That begs the question, then, how do men have estrogen? And the answer is via a process called aromatization. Aromatization is a simple term that means that we convert another hormone, in our case testosterone, into estrogen by using an enzyme called aromatase. So aromatase enzyme tackles testosterone, cleaves off a couple of atoms, and it becomes estradiol. This is called aromatization. Now, it's important to understand and then secreted into the bloodstream for systemic circulation, much like the ovaries do, then an estradiol in men would be an endocrine hormone, but it's not. So if it's not an endocrine hormone, what is it and where is it made? It is what we call an intracrine or paracrine hormone. Now, the difference between intracrine and paracrine is not dramatic. Paracrine means it works in and around, and intracrine means it works in. Endocrine means it works throughout your entire body via circulation. So an intracrine hormone like estradiol in men is actually converted inside of the cells of the target tissues that require it. So testosterone will enter the cell via an androgen receptor. It will run into the nucleus and it'll act as a blueprint and tell your cell to produce more protein. It increases protein synthesis. This is why testosterone is anabolic. Some of that testosterone will hit the aromatase enzyme within those cells and then convert into estrogen within that cell. And then that cell will utilize some of that estrogen for the functions that are needed via the estrogen receptor. There's a lot of estrogen receptors in the body and there's a lot of functions needed. I won't go into that. You can look up the studies to understand the benefits of estrogen. You could also read the studies on everything I'm saying now. I mean, this is documented medical literature. This isn't me hypothesizing. This is all documented in literature. So at the end of the day, when you have estrogen within a cell, it performs an intracrine function. When that saturation occurs within the receptors, the leftover estrogen is then excreted into the bloodstream for systemic circulation, not for the purpose of agonizing other tissues, but for the purpose of excretion. Other studies I've looked at claim that up to 85% of the estrogen in men is excreted via the urine. Our urine comes from our blood by way of filtration through the kidneys. So the excreted estrogen from the cells circulates the blood for excretion. That is what you are testing when you're checking serum estradiol levels. You're checking what is being taken out on garbage night to the curb to be urinated out of the body after we've already saturated and performed the action. Understand why this is important. When you block the aromatization of estrogen by utilizing an aromatase inhibitor, you're essentially inhibiting your body from producing estrogen in all of its target tissues, your brain, your heart, your liver, your kidneys, your pancreas, your bones, your muscles. Everything is delinquently deficient in estrogen because you have declined the aromatase enzyme from forming and your body cannot get what it wants. Dr. Abraham Morgentaler is a prominent urologist with Harvard Medical. He has published saturation studies regarding dihydrotestosterone, or DHT. This is the second metabolite of testosterone. So we have testosterone. It converts via the aromatase enzyme and aromatization process into estradiol intracellularly. We have dihydrotestosterone, which is a metabolite of testosterone, converted via the 5-alpha reductase enzyme intracellularly. Both play a key role in the function of humans, and both are self-regulated. Both have been shown to have saturation models within the receptor Both have been shown to be excreted via the bloodstream, via systemic circulation. Both are levels that could only be tested in serum for a deficiency, not for optimal or increased levels, because we don't know the intracellular levels unless we biopsy every cell in your body, right?
Yeah.
So self-regulated, we're testing serum, which is completely moot on a metabolite that is self-regulated. Look up the Morgenthaler saturation model. This is why he debunked the whole prostate cancer theory of testosterone and DHT. This is why I tell guys, do not take finasteride for hair loss. You're blocking the 5-alpha reductase enzyme. You will have no DHT. You will destroy your sex life and your libido and your bone health. Do not take an anastrozole or any aromatase inhibitor. You will destroy all of the estrogenic benefits within your body. And do not allow your urologist to talk you into ADT or androgen deprivation therapy. If you're at risk of prostate cancer, seek a progressive urologist that understands that testosterone does not cause nor agonize prostate cancer progression.
Love that. I love the passion in your voice as well, Gil.
This is what I do for passion. This is my passion. And I have stated what I just said. That what I was saying is that it is frustrating on one hand to have to repeat it, but it is also an opportunity to reach an audience that perhaps have not had a chance to listen to it yet.
Yeah, 100%. I think it's really interesting that you mentioned there that the estradiol that we're measuring is just what's being excreted from the body. It's not what's actually being utilized and what isn't required by the body, which is going to reach saturation, perform its function anyway. And one thing I guess that you didn't mention, and for anyone listening, what are the primary benefits of estrogen in a man?
There are very many. Just to name a few: increased sex drive, increased bone mineral density. I mean, think about women post-menopause. That's when they develop all of the risks like osteopenia and eventually osteoporosis, muscle wasting or sarcopenia, increased CVA risk or stroke risk, increased cardiovascular events, decrease in endothelial health, which leads to an increase in aneurysm risk as well as hypertension, dyslipidemia, an increase in triglycerides, LDL, VLDL, and a decrease in HDL. All of these things occur in women post-menopause. What is the key factor in postmenopausal women is a rapid and sudden decline in estrogen. Why do women have lower cardiovascular risk than men? Because estrogen is cardioprotective. So when a man goes on an anastrozole, he's essentially going on a class of medications known as chemotherapy. Anastrozole is part of chemotherapy treatment for women with breast cancer. Now, if you are a breast cancer patient, our goal is not to worry about your cholesterol, your bone mineral density, your endothelial health, your muscle tone, your metabolic function, which by the way is also controlled by estrogen, like fat loss and risk of type 2 diabetes and insulin resistance. Our goal is to save your life. So the primary approach to cancer is chemotherapy. We know that chemotherapy destroys the body and the health, but we also know it can save your life. Why would you relegate yourself to lifelong chemotherapy when you're not a cancer patient, like a man on TRT who's trying to optimize and then going on an anastrozole? It blows my mind. Just Google anastrozole and look at the drug class. It is chemotherapy. Stop and ask yourself, why am I on lifelong chemotherapy? Where's the logic? But again, all you have to do is go back to what I just discussed and understand how estrogen is made, what the key benefits are, and stop blocking its production. If Mother Nature or God or whoever you answer to when it comes to the human body decided that estrogen was bad for men, men would not have estrogen. Our bodies are not self-destructive. Okay?
Yeah.
When your body becomes self-destructive, there are two terms for that: autoimmune or cancer. So unless you have one of those, stop thinking your body's trying to destroy itself.
Yeah, that makes sense. Our bodies are amazing, aren't they? And actually, if we give it the opportunity, it usually regulates itself and it wants to be in this optimal state.
Our bodies are far more amazing than we can ever comprehend. So when we try to intervene in things that are logically not there, like interfering with the metabolites of key hormones, we are causing harm. And this is not just me stating this. It is backed up by clinical studies. It is backed up in medical literature. And it is backed up by thousands of anecdotal case studies that I and my colleagues have seen firsthand. Guys coming in from transfer clinics that they come into us on an anastrozole for a year or 2 or 3. They have severe joint pain in their elbows, in their knees, their neck. They don't sleep well. They have night sweats. They're irritable. They can't get rid of belly fat. They're insulin resistant, right? These are all symptoms of low estrogen. Plus, there are other, things that the medication causes directly. Secondary to lowering your estrogen, the medication itself is poison. Do not take aromatase inhibitors. Do not take DHT blockers. Testosterone does not cause hair loss. Testosterone, or specifically DHT, may accelerate hair loss in cases where you are predisposed genetically to the male pattern baldness gene, which is inevitable. If you have it, you're going to lose your hair. So if it happens a year or 2 sooner, is it worth ruining your life and risking post-finasteride syndrome for the sake of saving a couple of strands for another 18 months? I don't think so.
100%. So where do you sit with the GLP-1 agonists, the semaglutide and Mounjaro and things like that?
I've always been totally against medical weight loss up until last October. And I'll tell you why. Most weight loss drugs in the past, phentermine, etc., the dopamine agonist class like Adderall and Vyvanse and all these, they've always been a crutch, a band-aid, if you will, a way to reward people who are lazy and unwilling to make dietary changes by saying, hey, we're just going to either suppress your appetite, or we're going to speed up your metabolism, or we're going to do things that aren't really healthy for you for the sake of helping you lose weight because you're just unwilling to do what you're really supposed to do. I've never been one to reward laziness. I've never been one to want to be around excuse makers. I don't empathize with excuse makers. To me, adults need to be accountable for everything. If you screwed up, you better say I screwed up. You better own it. You better fix it. I don't like excuses. I'm not perfect, but when I screw up, I say I screwed up, and I'm harder on myself than you can ever be on me. If I make a mistake, believe me, it's going to haunt me, and I don't like it. So you don't have to be that extreme, but you better own up to yourself. And excuse makers never get anywhere in life. They just keep pointing fingers. And then the last thing I'm going to do is reward those people for their behavior. So I've never been a fan of medical weight loss. Now, fast forward to GLP-1s, end of 2022, I start paying attention to the fad because there's always fads coming out. And I see it's gaining popularity. And then I see that the FDA actually approves it for weight loss because it's long been a type 2 diabetic type of a treatment. Now, arguably, we could all benefit from a lower A1C if, in fact, we're in the mid-5s, pre-diabetic, or if we're type 2 diabetic. We could always benefit from a lower A1C. This medication actually improves insulin sensitivity, which is a welcomed finding. This medication does slow gastric emptying, which, depending on the individual, may or may not be a welcome finding. Some people do struggle to control their meals. They have good intentions. They do want to follow a meal plan. They just suffer from hunger. A lot of people have an emotional relationship with food. They eat to calm their nerves, their anxiety, their depression, their boredom. They don't know how to handle anything outside of food. Remember, going back to social aspects again, we meet friends at restaurants. We meet friends at coffee shops. We don't just meet friends somewhere to sit and talk. It's always over a meal. Your car doesn't meet another car at a gas station, right? Your car uses fuel as fuel. We don't see food as fuel, which is really what it is. It's a way to fuel our body and our life. We see food as a social environment, a social propellant, and it shouldn't be that way, but it is what it is. I'm not going to change society. But if you can help someone make wiser decisions by coupling a meal plan and an exercise program along with a GLP-1 agonist, which is going to it's not an agonist, it's a mimicker, GLP-1 mimicker. You're going to enhance their health by lowering the A1C. You're going to give them a fighting chance at learning portion control, learning how to follow a meal plan. It takes about 3 weeks to create a habit, right? It's very difficult to break habits, but it's very easy to replace them. You can't take something away and leave a void. You have to fill that void, or it's going to fill itself with bad habits. So when I take away one of your habits, I have to replace it. So if I'm going to replace your bad eating habits with good eating habits for 3, 4, 6 weeks, that eating habit, that lifestyle is going to help you sustain. Eventually, when you come off that GLP-1, the goal is that you've now had sufficient time under good habits to maintain those habits. And you and I both know nothing is more motivating to a person than success, than seeing results, tangible results that they can feel and touch and see in the mirror. So if someone's been on a GLP-1 for 3 months and they've lost 35, 40 pounds, right? Or for your viewers, 20 kilograms, that individual is going to be so motivated to not regress and to maintain that level of progress and success that even when you start to take away some of that medication or titrate off, they're probably not going to go back to eating the way they were. They're not going to go back to laying on the couch. They're going to want to maintain that. Because of that, I am a fan of the GLP-1s for people that do not have contraindications. And I've seen tremendous results and people really benefiting in every aspect of life. Remember, we give them a hormonal balance to improve their life. Sometimes they need a little bit of extra help to really take it to the next level.
Yeah. Yeah, I love that. And do you, I think you mentioned a little bit about it before, but how much help do you give people with things like diet plans, exercise plans? Do you discuss that, or do you kind of say, go and
I no
research?
longer do. So for many years, so I used to own several gyms. I used to be the lead nutrition plan writer for the gym. I used to be the training programmer for the gyms. While I have the background, the knowledge, the certifications, and the know-how, and I teach a lot. I teach a lot of providers on what we do and how we do it. So I don't have the time per se, but to be honest with you, I don't have the desire. Nutrition is such an intensive hand-holding / babysitting type of approach. I love working with people who are dedicated and committed. Unfortunately, most people want the results and they truly don't understand what it entails or how difficult it is nutritionally and training-wise to achieve. And once they start, they fall off. They don't have it in them to actually stick with it. And this is why a good physique is the most coveted trophy on the planet. You can't buy one. Look, Elon Musk doesn't look good. The guy could buy whatever he wants. He can't buy his body. This is why everybody looks at somebody who's in shape and says, wow, because you know the years of work and dedication that went in. You know the training that went in, the deprivation of nutrition and how hard they've worked to achieve that physique. They can't go out and just pay for it. So because of that, everyone wants it, but very few actually achieve it because they don't understand what it takes. People become combative. Like I said, I don't like excuse makers. I don't like to fight with people or argue with people. Look, this is science. I'm going to treat you like a robot because this is science. I don't care about your emotion. I don't care about what you want to do on a Sunday night or how many glasses of wine you want to negotiate with me. This is the science. You follow it or you don't. And too many people don't. And therefore, I get frustrated. I don't like failures. And if you're destined to fail, I don't want you under my belt. So because of that, I refer out all of my nutrition / training people. I don't get a kickback. I don't want a kickback. I have no affiliation. I have no skin in the game. But I have some trusted individuals that I am confident in turning my guys over to, if they wish, and girls. I have somebody who handles women as well. If they wish to learn, they can go and they can pay that individual to coach them and teach them and write nutrition for them. I no longer wish to do any of that.
Yeah, people like Ali. Ali was on the podcast as well a little while ago.
Mm-hmm.
Who has obviously lots of
guys.
I
have a handful of people. I mean, I've sent many of our patients to her as well. I mean, I have a handful of people that I refer out to for that purpose. This is what they do. This is what they're paid for. This is what their passion is. I don't try to be a jack of all trades. I try to do what I'm good at. I try to do what I enjoy. Most importantly for me at this point in my life, I want to do what I enjoy. I refuse to get up in the morning and do anything that I dislike.
Love it. Yeah, I think if everyone did that, then you couldn't go too far wrong.
No, people chase the wrong goals. That's the problem. If you just get up every morning and do what you truly enjoy, you're going to do it damn well because you're doing it out of sheer desire. Mm-hmm. And when you do something well, people take notice. And when people take notice, they want to be a part of it. And when people want to be a part of what you do, the side effect of that is good income. So stop chasing money and start chasing passion, and the income will follow. When you chase money, you end up living a life that is so empty because you're getting up every day and doing something you hate because you thought you're going to make money. Eventually, you're not even going to do it well and not really make that much money, and you're still going to end up miserable. So chase your passions, do a damn good job, make it undeniable to everyone around you, and you will be paid to do it.
Love it. Absolutely love it. And it's probably a good place to wrap things up. But just to finish things off, what if someone's watching? One, how do they contact you? But what one piece of advice could you give for anyone listening that will probably elevate their life or elevate their wellness?
It's funny. I had to give a speech 2 years ago to a group of graduating students. Most of them were about half my age. And I didn't want to get up there and be all cliche and say, oh, go on to this, do that. But I told them what I truly think, looking back on almost 30 years in business, that I've learned. Because I teach a lot of professionals nowadays in the medical field. In the past, it was in other industries, but I teach a lot of professionals the mindset of business and sales and transacting and interacting and relationships, the relationship with money, the relationship with friends, family, clients, etc., and how their mindset truly translates into what other people perceive. And the one thing I told this class is probably the best piece of advice that I can give anybody. And that is that self-doubt will kill more hopes and dreams than anything else on the planet. How you view yourself and your abilities will become your reality. If you think you can't do something, you are correct. And if you think that you can, you are also correct. Now, let's not get crazy and say, I'm going to spread my wings, jump off a bridge, and fly away. But the litmus test that I use to define, can I do something, is this: has another human done it before me? And if the answer is yes, so can I. If the answer is no, it doesn't mean I can't. It just means that I need a little further assessment. We've had many innovators throughout the course of history, and they were the first to do something. If I think I want to jump off a bridge and spread my wings and fly away, I may be wiser than trying it first. But if I think that you, Ross, have done something in your life that succeeded, I know damn well that I can do the same. And there's no human on earth that I think is better than me. I personally don't think I'm better than anyone else. I think perhaps I'm a little more open-minded than most, and I have a little more self-belief than most. That is it. And if people woke up and had the same amount of self-belief, they can do the same and probably more. So that is the single best piece of advice that I would give my kids or anyone else, regardless of what industry you happen to go into.
Love it. And if someone wants to reach out to you and get a consult, how do they do that?
Easiest way would be to go on my current website, which is it's not under construction. It's going to be changed soon because I no longer do dietetics, but nextleveldietetics.com is an opportunity to purchase a 30-minute phone call or a Zoom call to discuss anything and everything you may want to discuss. Could be hormones, could be whatever it is you want. You want to talk about weather and traffic, we could do that for 30 minutes. But nextleveldietetics.com can get you a 30-minute phone call. And if you're based in the US, from there, I can also refer you to my medical office. If you're international, you want to go over some labs, go over your protocols, go over your lifestyle, whatever it is, I'm open to it.
Amazing. Gil, I've thoroughly enjoyed our conversation. Thank you very much for joining us. And enjoy the rest of the day.
Likewise, I appreciate it very much. Thanks for having me on.